Yeah, welcome back to DXB today. I hope you're enjoying the show thus far. I hope you're taking a lot of advice from our special guest. Looking at all things beauty today in all its different forms. Looking at the aesthetics, looking at plastic surgery and more. And our next guest, no stranger to that, consultant plastic and aesthetic surgeon, much in demand, specialising exclusively on the natural look, natural looking results. Please welcome Dr. Leonard Josipovic from the Lucia Clinic here on the sofa. Dr. Leonard, great to have you with us. Thanks for joining us.
Thank you so much for inviting me. Great pleasure to be here.
I suppose the perfect question to ask, Leonard, is that idea of the natural look. It's what everyone aspires to, but as we all know, sometimes you're not getting that natural look. Again, how much of it goes to what we were saying to a little bit earlier on about managing expectations from clients when they come through?
Well, managing expectations, like Doctor previously said, I think this is one of the most important things.
Yeah.
To set the realistic goals. And recently I was giving an interview and somebody asked me, Doctor, how do you become a better plastic surgeon? And I think you become better in that what you do when you become also better psychologist, understanding the psychology of your patients better. And that also includes the setting of the realistic expectations. Very important, very important.
Yeah.
I'm glad you brought that up actually, because earlier on Dr. Adil was saying how as a young doctor there are some of them who would have wished that they didn't operate on that certain patient. Now, since you're talking about the psychology of it, are there any types of patients that you would choose not to do a procedure on?
Oh, definitely yes. I definitely decline also certain procedures regularly because patient put sometimes in their mind, they read something somewhere, or they have a friend who did something, but doesn't mean necessarily that this procedure is going to be the right one for the patient as well. So I think that this is also our job we are professionals, we are experts, and we have to lead our patients. So we have to give to the patients exactly that what the patient needs, not necessarily what the patient is asking for.
Agree.
Leonard, people don't know that, but you're an expert injector, huh? You've worked for Allergan, you've taught so many doctors throughout the region and how to inject. And my question is, when is it too much filler?
This is a very good question. Thank you so much.
Yeah.
I think, like everything else, when we do too much of whatever we do, it can lead to opposite effect of that what we want to achieve. I think the fillers are amazing if we know how to use it, and if we have also the level of that, how much we use it, because we see so many different examples of really bad work.
There's that term, filler fatigue, that's coming out now.
Yeah, overfilled face. We can see that like in all media now, and especially some actors with overfilled faces, changed faces. Definitely filler treatment can go wrong, but there's one nice thing about the filler treatment, to come back also to your question, whatever you do with fillers, at least you can make it reversible. So you can dissolve that, you can go back to natural. I was also big fan of fat transfer before. Also to the face. Today I like to do it more to the body, for BBL or for the breast. But for the face, I think if something goes wrong with the fat, it's very difficult to make it reversible, to take it back. And with fillers, we still have this possibility to dissolve. So I think those kind of like overfilled faces, pillow faces, that can definitely go wrong. Not every patient is reacting in the same way. And also the number of the treatments and the fillers is very important, and how we do it. So I always say it's very important to choose your professionals you're visiting with, because today, sure, we all know there's a lot of different possibilities to get injectables done, to get fillers done. And yes.
I think there's also an age where fillers don't work anymore.
Exactly.
People have to face the knife.
Exactly.
You know?
I think exactly like you said, some certain things, nothing can exchange. There's surgical cut sometimes exactly the best one for example, for the eyelids. If the patient is having like droopy eyelids and complaining about that and want to fix that with Botox or with fillers, we can try this, but probably it's not going to lead to desired effect. Like blepharoplasty, very fast, smooth, easy procedure, which is going really great, and recovery is very fast, and after a week you see already an amazing result. And there's nothing what can replace, for example, surgery in this case.
Hope you're taking notes, Lane.
I don't completely, mate. Seriously, Dr. El, it's so always good to see you. So when it comes to the celebrity stratosphere, when it comes to this, it's big time. Obviously, they can afford it and stuff like that. But who would you say are some at the forefront when it comes to looking good, when it comes to the whole celebrity world of plastic surgery?
Well, usually we have the bad examples, which we're talking about, and then we think, oh, this is bad work. I'm never going to do anything on my face because I don't want to look like that. But there's also like a bunch of others like Salma Hayek, Jennifer Lopez. They're just looking great in their...
Perfect.
Sorry?
Brad Pitt.
Brad Pitt looks amazing.
Is Brad had surgery?
Some of them we can't even tell.
No.
Yeah,
Oh, yeah,
and
he
I
had
think
a-
the point
Oh, he
of-
had a facelift. Huh?
yeah,
He had a facelift.
but looks amazing, right? And that's the point. I think no matter what we do, if you do a facelift, injectables, lasers, whatever, I think the point of the procedure is always to make it look like I was born like this and I was not made like this, right? So if we manage that, no matter which treatment, which procedure we choose, then I think we achieved good work.
Isn't
right?
that the greatest compliment? If somebody's asking what they've had work done, because if somebody's asking that one, then you've got that natural look that you're sort of looking for. Is that right?
Yeah. I think if you already see on somebody's face that something has been done there, I don't think it's a good work, right? So it's much more about that you see somebody who's looking good, beautiful, and you think like, why is this person not aging, or why is this person aging so well, right?
Bad example is also Demi Moore. I think she was
Yeah.
botched. big
But
time.
I have to say,
Yeah.
she changed again. I've seen her recently, and she went back to normal again. But a couple of years back, you're 100% right about that. She started to look very weird with like too many procedures done. But now in her, I think, close to 60s, she's just like really attractive at the moment.
I mean,
Demi, if you're listening, if you're watching, Demi, these guys can help. It's okay, just come on over. It could be, I just want to wrap up on Dubai if I can. I know that I asked Dr. Adel a little earlier on. How exciting is it here at the moment in terms of the procedures that you're doing, the demand that you're seeing, people flying in, the population growth here? Is this going to be an industry that grows here in the years to come?
I definitely think
Yeah.
that Dubai, especially Dubai in the Middle East, is going to be the city where the people are going to travel even more for different reasons, but also for medical reasons. And me personally, I was working for a very long time in Germany before, and I had a lot of patients there. Then I decided to move to Dubai. And now I have regular patients coming to visit me, even in Dubai clinic, which I never expected before. But they're just coming for a vacation and then combine that with the treatment and combine that seeing a doctor. So I think there's a lot of other examples of that, and especially Dr. Adel, he has also beautiful clinics across the whole region.
Hospitals,
Yes, exactly. I'm sure that you can confirm exactly the same, yeah.
A lot of people talk to me about recovery here. You know, the sun shines in the GCC at this time of year. It's absolutely beautiful across the whole of the GCC. With that with those conditions, does that speed recovery or not?
What do you mean?
In terms of people feel a little bit more relaxed, you know, they can mix a 2-week holiday or something
Combine
like that.
holiday with the recovery.
Yeah, I mean, we see that. Yeah.
Yeah?
We see that. We see that a lot. I mean, the thing is, the one thing about Dubai, you know, it's like in Kuwait or in Germany, you see mostly German patients, or you see mostly Kuwaiti patients.
Yeah.
Here, it's a total different. You know, one day you see some patient from China, then from India, and then from Nigeria, and of course, for us plastic surgeons, that's challenging because you know you're dealing with different anatomies and different needs, like you know.
And
So,
it's
yeah.
at the same time also a beautiful thing because
Yeah.
we face so many different cultures,
Exactly.
different
Yeah.
faces.
You have to maintain that beauty.
Yeah, and
that
Dubai
culture, yeah.
became already a long time ago, I think, melting point of different cultures and different nationalities. And I have every day in my office another surprise, a patient from different parts of the world, which is beautiful, which is
Something
amazing.
different every
yeah,
day.
definitely.
Long may it continue, because then that means we've still got the show. That's fine, okay? So let's keep that one there.
You might get another surprise from Tom and I, I'm sure, at some point, maybe.
With great pleasure, anytime.
Thank you so much for being here, Doctor. As usual, your pleasure.
Thank you so
Cheers,
much.
man.
Thank you.
Louis, I think it's about that time where we test our
Oh,
co-host.
yes. You are right, Lane. It is time for DXB in 60. Dr. Adil, we've been learning a lot from you about what you know about beauty and cosmetic surgery, but now we want to learn more about you in particular. So in 60 seconds, rapid fire questions, we want to know as much about you as we can. Are you ready?
I'm ready.
Well, the timer starts in 3, 2, 1. Doctor, your first job,
My first job as a
even as a child, maybe as a teenager?
no, I never had any jobs. I was just like,
Really?
yeah.
Straight to being a doctor. All right, your motto in life and in work.
Work hard, persevere, stay, just keep it real. Basically, keep it real.
A hidden talent that you have?
I'm a swimmer. I'm been in the swimming team, Kuwait.
Wow.
Yeah,
That's good.
so I was the champion actually for the whole of the GCC countries when I was younger.
Wow.
Nice.
Yeah,
The number one most requested surgery or treatment in the UAE.
liposuction. Yeah.
Best piece of advice you have had? It's a tough one.
It's a tough one. I mean, there's so many good. Just stay focused. Stay focused. Yeah.
A superpower you wish you had?
To suss out those patients that I shouldn't be operating on. Because they sneak up on you, you know.
We are out of time, doctor, but we have one last question. Why Dubai?
It's a hub. It's you know, if you're not in Dubai, you're not in the GCC. So I mean, like I said, I was in Kuwait, I was in Doha, but I mean, if you don't have a hospital in Dubai, then you know, it's a landmark. You have to have a hospital, for sure.
Agreed.
Dr. Adil, we can't thank you enough. Thanks so much indeed
Thank
for
you.
being with us. I know that your time is everything for you. Your time is your premium. So for you to give us a bit of time today, it's really,
you guys
really
for having me.
appreciated. Thanks
Yeah.
for guest co-hosting with us today. And the same goes to you, Dr. Len. Thank you so much indeed. Really appreciate
you
it.
so
Thanks
much.
for everything you're doing
Thank
here
you.
at the moment. Yeah. A big thanks to our two doctors, but worry not. Yeah, we might have been talking about plastic surgery and aesthetic surgery, but it's all about Body Beautiful next. I'm looking forward to this one. Lane, I'm not sure if you are at the moment, but I'm told that you're going to be put through, get this, muscular strength, flexibility, mobility, and cardiovascular endurance, all within the next 5 minutes. You ready?
Right.
Stay tuned. It's going to be absolute belter.